The Caribbean Environmental Health Institute is providing technical advice and assistance to the committee responsible for cleaning up St. Jude's. A major component of this is the removal of materials containing asbestos. The roof of the surgical ward was completely destroyed by the fire that ravaged the hospital. It too was covered with asbestos. The Institute's Executive Director, Dr. Patricia Ackwing, says CEHI is ensuring workers on the site are protected from the hazardous material.
The roofing at St. Jude's contains, which is concrete slabs, contains some asbestos materials. So particular care has to be taken by the persons involved in asbestos removal to ensure that they are well protected by wearing proper overalls, N91 respirators, boots, gloves, and so on. And that is going to be supervised by us to ensure that those procedures are followed.
But asbestos is not the only environmental health issue at the hospital site in VA4. Dr. Ackwing says those engaged in the cleanup efforts must be protected against other forms of environmental pollution that can result when an almost 70-year-old building is gutted by fire.
Bearing in mind that St. Jude's is an fairly old building, certain kinds of materials that would have been used, and when fire, of course, gets to certain kinds of materials, it can produce in some instances dioxins and furans, which again can be hazardous to human health. So the approach that we are advocating is a thorough, holistic approach, ensuring that we, from the very outset, that these things are well managed, that the persons who are doing the cleanup operations are well briefed and trained, and that they supervise well to the point of the actual disposal of these materials, so that at the end of the day we minimize whatever kinds of risks there might be in terms of the health aspects for the persons who are involved.
The cleanup process will be followed by rebuilding, and CEHI officials say the latter process should not involve asbestos. Dr. Ackwing says the material's danger is not in its use but handling. However, she says contractors should steer clear of the substance.
We have, for instance, pipes that use asbestos, old pipes in our water systems in a lot of the countries. However, the problem comes when these start to crumble and deteriorate and the fibers are let loose into the atmosphere and it gets into our lungs and so on. So the management of it is what is important. Nowadays, there's such a scare about asbestos, nowadays and in recent times, such a scare about asbestos that the intent by most people is to shy away from it. And of course that would be the recommendation, because you do not want to run the risk of using asbestos-ridden materials and find that you have problems down the road because persons are not adequately trained or aware of some of the health risks that might be involved.
Dr. Ackwing says CEHI will also conduct a post-cleanup assessment of the area. This is to ensure the environmental health hazards are adequately addressed before staff or patients re-enter the facility. Alison Kentish, HDS News, Channel 4.